Bonsoir, bienvenue dans l'émission Santé Plus. Alors, ce soir, nous allons parler d'un topic qui est très important regarding the men's health et nous allons accueillir le Dr Raghubir Bhardwaj qui est le Senior Consultant Urology chez Care. Hello doctor, how are you?
Hello, I'm good. Thank you so much for your kind words.
So 17 years of experience as urologist.
Yes.
That's great. So could you be more precise about what does a urologist do?
Urologist, as the name suggests, urologist usually deals with the urinary problems. So it's different from a nephrologist because as a urologist we deal with the surgical aspect of the urological problems. Not only the surgical aspects, as medical aspect also, but the diseases associated with the urinary tract, the surgical aspect we deal with, and also the male sexual organs.
Could you explain us what type of health issues does a patient have that falls under the urological problems?
As I said, urology deals with the urinary tract, so any problem ranging from the kidney to the prostate to the external genitalia. So for example, stones in the kidney and associated problems with the urinary bladder like stones and the blood in the urine, then the testicular issues, the prostatic issues, not only these conditions but even the cancers associated with kidneys, with the urinary bladder, with the prostate, testicular cancers, penile cancers, all fall under urological care only.
Normally when we talk about urology, we feel that it's only a men's issue, right? It's a male issue. So what would you say about the women? Are they affected, are they touched with this particular problem?
Yeah, that's a very good question. For that matter, no gender is immune to urological problems. The men, they do get problems and associated the prostatic issues because it's only a male organ, but females usually have this urinary tract infections and stones. These issues are common in females, and especially recurrent urinary infection in young women. It's not a very uncommon problems. So they do come to us, and the certain women, they have difficulty controlling urination, especially after childbirth and all. Certain changes happen, and those patients, they do come to us.
Doctor, can you tell us what are the early signs or symptoms that can make someone think that it's time for me now to go and visit a urologist?
So very simple answer to this question is, whenever you feel that there is something which is not normal, it means the way you are passing urine now is not normal. The way you are passing urine now is different from what you were, how you were passing a year ago or a month ago, or you feel that there is some discoloration in the urine color has changed, or there is burning, and control is a problem. So whenever you feel there is something away from the normal, you must visit a urologist.
Yeah, so they should come up and open up and go to a urologist so that they can seek for advice and start the treatment if necessary.
And as a caregiver, this is our responsibility also to create awareness among the people, that this is not something very uncommon, and people do have, and if not treated properly, this may lead to other problems as well.
Je vous rappelle qu'on est en conversation avec l'urologue Dr Raghubir Bhardwaj. Donc restez branchés, on revient après la pause pub. So doctor, if someone is having such sorts of health issues like urinary, sexual health issues, and if not treated on time, so as you said, it might lead to some other complications. Can you elaborate about it?
As far as sexual health is concerned, it may lead to other psychological issues, may lead to, because you are not the only person who is associated with this problem. There are people who are associated with you, people around you, your family members. So these certain issues may lead to family discords, and the personal relationship with the other people may get affected. So it is very important to not to ignore these problems and get the timely treatment.
So doctor, can you tell us how can we normalize this conversation?
Yes. Regarding sexual health, first of all, the people should understand that nobody is going to judge you, or nobody going to make an opinion on the basis of what your complaints are. And the person you are discussing with you is a very professional. In C-Care, we discuss these issues in a very professional way, and a complete secrecy is always assured. And confidentiality we always respect. And you must feel free to come and discuss these issues if at all you have, and we are here to help you.
Would you recommend men of the, let's say, 40s and 50s regarding their routine checkups and screening that is recommended?
Yes, routine checkup for the urological problem, as I mentioned, that whenever, for that matter, any age group, if you feel that there is something abnormal you are feeling in your urinary, the way you are passing urine is not normal, it is, so you must go and see a urologist, especially the people in the 40 years of age. They may have problems associated with the stones.
When it comes to prostate or bladder cancers, how do the urologists and the oncologists work together to give a better treatment?
Yes, so when we talk about cancer, it is always a multidisciplinary approach. So the multi-specialities, especially urologists, as a urologist, we take care of the surgical part. When it comes to the cancer of the prostate or the bladder or the kidneys, but whatever is required after that, in certain people we might need chemotherapy, they might need immunotherapy, some people they might need radiation therapy. So it's a multidisciplinary team.
So doctor, do we have the radiotherapy treatment at the C-Care Cancer Center?
Yes, we do have radiotherapy available at the C-Care Cancer Center. We have state-of-art radiotherapy available, and we have radiation oncologists who monitor these treatments and to get the best of the results.
Alors, chers messieurs, dames, si vous avez entendu les conseils pratiques venant du docteur Raghubir, donc break the taboo, speak up, and come for your treatment. Merci et bonsoir.